Okay, in this video we're going to demonstrate how to perform a cannabis drug testing cassette. Marijuana or cannabis is widely used and is very easy to test for using a simple urine test device such as this. They're widely available to buy online. They're very cheap and they will accurately detect cannabis and its metabolites being excreted in human urine for a window period after it's been used. Now, commonly after a single one-off exposure you can detect it's still in urine up to around 5 days after it's been used. In a heavy regular user that stops, the cannabis can still be detectable coming out of their system up to 28 days later. So it's a pretty broad window depending on the concentration of cannabis and the duration that it's been used. Conducting a test is very simple. When you're ready to do it, just remove the test cassette from its foil, and you'll see here a standard format for the cassette. If I bring that close to the camera, you'll see that here we have a sample well, which is where we're going to add the urine sample to, and marked on the cassette you have a C and T zone, which is pretty difficult to discern in this light, but it will mark on here for you where the control lines and test lines will appear. So to conduct a test, fresh urine sample, take the pipette that comes packed with the cassette, 1, 2, 3 drops of urine. Pipette can then go back into the foil, lid back on the urine sample, and what you may be able to see, if I bring it a little closer, is the pinkish dye starting to travel along the area of the test result window as it travels towards the end of the cassette. Now, also marked on the cassette quite often is the coding for what type of cassette it is, so if it has been removed from the foil which is labelled, this cassette is actually embossed with THC for tetrahydrocannabinol. That's cannabis screening. Now if you look at this test window, you'll see 2 lines developing. One at the area marked with a C, which stands for control, and the second line developing at the T or test line. Now it's the presence or absence of a test line by which you determine the result. If there's cannabis in the urine sample at 50 nanograms or above, then it will completely bind this area and not allow any dye to form. So a positive test is indicated by a control line, but the absence of a test line at 5 minutes. Now, this is a clear negative result for cannabis. There's no cannabis in this sample and both control and test lines have formed. So even after 1 or 2 minutes, when you've got those clear 2 lines, it's okay to discard the test and interpret your result as a clear negative. You will notice a wide variation in the test line colour, saturation and density. This has no bearing at all on how you should interpret the result. Any test line forming in the presence of a control line must be interpreted as a clear negative result for cannabis. So that's it. The cannabis urine testing cassette takes about 3 to 5 minutes to complete a test. Very easy and simple to do. No more complex than running a home pregnancy test in reality. And the accuracy of these test membranes now is in the order of 99%. So as a screening procedure to exclude all your negative results, it's extremely accurate and very reliable.